have already discussed about the clavicle and its bony landmarks, let's have a look to the muscles which are attached on the clavicle, which are getting the origin from the clavicle or which are inserted over the clavicle. As we have already seen about the clavicle, okay, let me make it more simple. This one is the medial aspect, this part is the medial aspect of the clavicle, and this is your lateral aspect. As I have already demonstrated, this one is the medial aspect and this is the lateral or acromial. This medial, the sternal, okay. This is the sternoclavicular joint. So here is the left one, left sternoclavicular, and here is your right sternoclavicular. Here it is the here must be the right acromioclavicular. Here you all can see the left acromioclavicular. Okay, so we are focusing on the left one. This is the left clavicle. If you talk about the medial aspect, we have already seen there are the four surfaces on the medial side of the medial end of the clavicle. The number one, you have an anterior, which you see from the front. Okay, if you see the anterior border gives attachment to the main muscle. Okay, as we have removed the pectoralis major, here the small muscle you can see number 97. This one is the pectoralis minor muscle. The anterior surface, as I demonstrated on the skeletal also, this anterior surface is giving origin to the pec major muscle. Now if you see on the superior surface, here a long muscle this way, this long muscle is the sternocleidomastoid. It's getting origin from the 2 points. Why this is called the sternoclavicular mastoid? Because it has two ends, the sternal end, this one, this getting origin from the sternum, the manubrium of the sterni, and this is the clavicular part which is getting origin from the clavicle. Simple as that. So sternocleidomastoid, always it is inserted over the mastoid process. Here you can see always it is inserted to the mastoid process. So this muscle, basically SCM, is getting origin from the sternum. If I make two fingers like this, the sternal end and the clavicular end, and always they are coming upward to be inserted on the mastoid process. So this muscle is the sternocleidomastoid. So the superior surface is giving getting origin or giving origin to the clavicular part of the SCM, sternocleidomastoid. Let me remove this muscle also. As we have already removed the sternocleidomastoid, now if I remove the clavicle bone, here you can see the superior surface which was giving origin to the clavicular part of the SCM. Now if you talk about the posterior aspect on the clavicle, like if this is your left clavicle, so you are talking about the posterior aspect. If I show you, this would be the posterior aspect. This gives origin to a muscle which we call it sternohyoid muscle. Now this one is the superior surface, and this was the anterior surface, and then you have an inferior surface. So let me remove. If I remove the clavicle bone, here you can see the inferior surface. This red structure is a subclavius muscle. So where it is attached on the subclavian groove. Let me show you on this. If I show you the inferior, this is the subclavian groove which has two lips, the outer one and the inner one that I have already demonstrated. So this groove is getting attachment from the subclavius muscle. This muscle is the, as you can see the number in mentioned 29. This muscle is the subclavius muscle which depresses the clavicle during the shock absorption or overhead movements. Now coming toward, if I place it back to its position, okay. Now coming toward the lateral aspect, if I show you, the laterally and the acromial end has the superior surface. This one is the superior surface which is quite subcutaneous, and then you have the inferior surface, okay, and it has two borders, the anterior one and then you have a posterior border. This anterior border has the tubercle, the name itself indicating it gives origin to the deltoid muscle. This hallway muscle, this long triangular muscle is your deltoid muscle. If I remove this muscle, this muscle is the deltoid. This one is the deltoid which has anterior fiber, middle and the posterior fibers. Okay. This whole muscle was getting origin from the anterior border of the acromial end of the clavicle. Now if we talk about the posterior aspect, the posterior border is also getting the attachment, the insertion of which muscle? This whole way muscle. If I show you, this is the trapezius muscle, all way coming from the cervical, is getting the insertion over the clavicle and the spina scapula also. Okay, this whole long way muscle is basically the trapezius. Anterior border giving origin to the deltoid, the posterior border giving insertion to the trapezius muscle, and then it has the superior surface which is the subcutaneous, and it has the inferior surface. On inferior surface we have two tubercles, the conoid, and then you have a trapezoid lines. Let me show you. Okay, if you focus on this, on the inferior surface you have this structure. This is the conoid tubercle, and these lines, if I mark with the pencil, these are the trapezoid lines. The conoid tubercle gives attachment to the conoid part of the coracoclavicular ligament, while the trapezoid line gives attachment to the trapezoid part of the coracoclavicular ligament. So the coracoclavicular, the two ligaments coming from the coracoid process, basically connecting the ligament connects the bone to bone, connecting the two bones basically. So coracoclavicular ligament, there are the two ligaments all way coming from the coracoid process of the scapula, and they are getting attachment here. So conoid is more medial one, conoid is the more medial one, and it is 4 to 5 centimeter away from the lateral end, and the trapezoid line is basically 3 centimeters away from the lateral end. So conoid is more medial rather than the trapezoids. Trapezoid lines are lateral. Okay, let me show you. Okay, this one is your right aspect. So if you see if I focus on the acromial end, this is your acromial end and this is your sternal end. This is the superior surface, and now if you focus on the inferior surface. Okay, if you talk about the scapula, this is the acromion process, this is the coracoid process, all way like a finger, all way like a finger. So the ligaments coming from the two ligaments, one is the medial one which is the conoid, and one is coming which is the lateral is the trapezoid. So they all way coming from the inferior surface. Okay, from this one, the conoid coming from this way and attached to the coronoid process of scapula, and the trapezoids like this one and getting attached toward the coracoid process of scapula. So thank you so much. This was all about the clavicle.